At the Good Life Cooperative, we believe everyone can benefit from a little guidance as they navigate along the healthcare landscape. Some doctors say that the human body is like a car. If you inherited good genes from your parents, your body is like a high-performance, well-made luxury sports car that doesn't break down often. And while you can't change your body the way you can change cars or prevent your body from getting old, regular health screenings and lifestyle modification are essential to keeping you healthy. Just as getting your car serviced regularly and driving it carefully will help it last longer. This is how you do it. Osteoarthritis is a common disease, also known as wakatia. Do you feel, as you get older, that parts of your body aren't working as well as they used to? Your vision isn't as good. You aren't as fit. Your muscles aren't as strong. And you start experiencing pain in your joints. The truth is, about 1 in 10 Singaporeans have joint pain in their knee. And in the age group of 60 to 69, that number rises to 1 in 5 people. Why do so many people get osteoarthritis? Joints are complex structures held together by a combination of tendons, ligaments, cartilage, muscles, and bone, which all support each other equally. Anything that affects the health of any of these tissues can affect your chance of getting osteoarthritis. But 3 factors, muscle weakness, inflammation, and joint stress, play the most important roles. As we get older, our muscles become weaker. This increases the stress that is put on our joints because weaker muscles cannot support our weight like before. At the same time, our body's ability to regenerate important tissues, such as cartilage, starts to decrease and is exceeded by the wear and tear of daily movement. As more stress is then placed on joints, inflammation begins to set in, which breaks down bone tissues and encourages further degeneration of the joints. And because your joints are now swollen and painful, you move less. As you move less, your muscles get even weaker, which leads to more stress on the joint, more inflammation, and even further degeneration of the joint. The term used to describe this kind of degeneration of the joint is osteoarthritis. Osteoarthritis can affect any joint in the body, including the knees, neck, hips, and finger joints. Some people think that old age or wear and tear is responsible for causing pain in the joints. But as we have explained, age is not the only factor. Osteoarthritis can strike anyone at any age. They just happen to be more likely as you get older because deteriorating muscle strength, declining regenerative potential, a higher risk of injuries, and a sedentary lifestyle are more common later in life. But some people also have joint pain that have nothing to do with wear and tear, such as rheumatoid arthritis, tendinitis, gout, or other disorders. If you're experiencing symptoms of joint pain, get checked out to rule out other possible causes. You might want to ask, when should I see the doctor? You can use time as a gauge. If the pain persists in a joint for more than 2 weeks, it's probably a good idea to seek treatment. Or, if within a 6-month period, you experience pain more than 3 to 5 times, especially when you are performing the same activity like climbing stairs, that's probably a good sign that you should see a doctor about your joint. What can you do to avoid osteoarthritis? Because osteoarthritis is accelerated by stress on the joints. Reducing your weight will reduce your chance of osteoarthritis. If you are overweight, losing just 3 kilograms may relieve your pain. Exercise may also be advised by your doctor. Contrary to popular belief, exercise will not make joint pain worse. For example, if your thigh muscles are stronger, they will be better at supporting your knees. Then, there'll be not so much stress on your knees. You should also eat a balanced diet. If you already have painful joints, you can try dietary supplements such as glucosamine and collagen. What if, even though you've lived a healthy lifestyle, you still end up with osteoarthritis because of your genes? Your doctor may want to treat your pain, so he may give you an analgesic painkiller, either topically applied or in the form of a steroidal injection, which reduces inflammation and, in turn, the pain. If your joint architecture is deteriorating, you may be recommended to wear a brace to help support the joint and reduce its workload. Wearing good shoes can relieve the stress on your knees. Some people also do better with a walking stick because it takes stress off the joint.
Of course, there are people who will go for traditional therapy, so things like acupuncture, things like tuina, herbal medicines and all that. So herbal medicines, I would still look at them like your usual Western medicines. They are still the anti-inflammatory types, and they help to reduce pain, reduce swelling and all that. And then you also have your tuina, which is very similar to what massages that sometimes a physiotherapist or your sports therapist will do for you as well. This helps to relieve muscle soreness, tension, and the tightness and stiffness, so you can walk and move a little bit better. So acupuncture helps in two ways. It reduces pain, okay, and it also helps to reduce some of the muscle spasm and stiffness and tightness.
Not every person will get osteoarthritis that is bad enough to need a knee replacement, but there are some who have worn out their joints so much that they have to change it for a new one. If one side is worn out more than the other, then the legs will become crooked. This is a mechanical problem which cannot be fixed by taking medicine. Some people have wearing out of their joint in only one side, for example, the middle part of their knee. So the orthopedic surgeon will do what is called a uni-compartment replacement. That means he'll replace one part of the joint instead of performing a total knee replacement. However, most people will end up with a total knee replacement. A healthy lifestyle can help reduce osteoarthritis and reduce pain. Keep your weight down, stay active, get your injuries tended to. Eat a balanced diet, do all that, and you may avoid needing a joint replacement when you're old and frail. But if you do need to replace a joint, it's nice to know that you will be in good hands and have good knees again. Live the good life. This educational video is brought to you by the Good Life Cooperative.